Good morning, everybody. Good morning. There's a lot of familiar faces in the room. Thanks again for your time this morning. Again, I know insurance, health insurance is a very exciting topic, especially early in the morning, so I'm going to thank you in advance for your patience and focus. I do want to say, though, this is your time, and I mentioned this in prior years, that it's always fun working with your team because there's always a lot of good educated questions that come in. Sometimes I get a lot of blank stares when we do these presentations, but I know you guys are tracking a lot of the stuff we're talking about, which is great. There are a lot of new updates we're going to talk about from an industry perspective and also how that's impacted the PSI benefit plan this year. We'll get into that and get into an agenda here soon. But first, I just want to thank all of you for being here and also thank the PSI HR team and leadership team for the ongoing collaboration. I think you're going to find that while we do have some slight changes to the plan designs this year, well, one of the plan designs this year, overall still a very competitive, very generous benefit program, especially compared to a lot what we're seeing in the market. So we're going to get into all that today, but I just want to thank you for your time. Okay, so from an agenda, what we're going to talk about is we're going to go over what's in your packet, what's in front of you, and as probably most folks are aware at this point, don't close the door. Unless someone wants a smoothie. It sounds like you're making it. Most folks are aware of the fact that all your open enrollment is done through the PSI benefit portal online. And login instructions are in your benefit guide that's in front of you. Our team actually assumes that everybody forgets their login every year, so it's pretty easy to go and retrieve your password. So all those login instructions are in your benefit guide. So just some housekeeping up front. The system does go live today, so you'll be able to go in today and see all the rates and all the details. We're going to give you the high-level summary in your packet in front of you today and walk through those key changes, but then you'll be able to go online and see everything in great detail, all the summaries of benefits and line by line how everything works. But I'm going to hit the key points and the key changes in today's presentation. Then we're going to get into your current benefits, reviewing your current benefits of medical, dental, and vision continue to be with Cigna. You've got your group life, AD&D, short-term disability and long-term disability with Cigna. You've got a voluntary life program with Mutual of Omaha. This is the big one I got to emphasize in today's meetings because we've had some challenges with participation, and I'm just going to be very candid, open discussion with this today. I'm not trying to sell the life insurance, but we want to make sure everybody knows how it works. The voluntary life is a voluntary program that you pay 100% towards those premiums, and they're group premiums, so we've negotiated pretty low rates. The problem is that, not a problem, but it's kind of a problem. PSI offers such a generous group paid life plan, so they offer such a high life insurance plan to you as the employees that they pay for you, that a lot of people say, hey, that's enough, I don't need to buy more voluntary life insurance. So if you're one of those people on the fence and say, hey, maybe I do need more voluntary life, this is a year to do it. Mutual of Omaha has said, and I'll talk in more detail in a little while as I get to that slide, but Mutual of Omaha has said that they're going to offer another open enrollment. So you don't need to fill out any medical paperwork to get the additional life insurance, and it's very not expensive, and we'll show you that in your packet and show you online. But they've said if we don't hit a certain participation level, we need about 30 to 40 more people. I don't have the number off the top of my head, but we need about 30 to 40 more people to sign up. And if we don't, they're going to have to cancel the whole program because we don't have enough people in it. So that's kind of the spot we're in. So I want to make sure we talk about that today and everybody knows that that's where we are. Your flexible spending account continues to be with WageWorks. We'll talk about that. You do have some other additional benefits, generous benefits given by PSI, and we'll run through those briefly. And then we'll get into the practical, land the plan on the enrollment tips and reminders, a couple quick healthcare reform updates, and then we'll end with as you probably remember last year, a quick couple pop quiz questions, and whoever gets the answers right, we've got some prizes again this year. I've got what do they give? A mini mag light and a Kelly bag. So maybe not too exciting, but they're something. Okay. All right. So pay attention. All right, let's get into the packet quickly. So on your seats in front of you, you have a new PSI benefit guide. So thanks to the communication team here at PSI, they did a lot of work to streamline the communications, your new look and feel. And so we've got the PSI benefit guide here. Yep, and then you'll have, and in your benefit guide, you're going to see all the details about how the benefits work. You're going to see the login instructions. You're going to see the two medical plans. I'm not going to go into all the detail on the benefit guide right now because it's going to track with the PowerPoint. So everything I've got to say to you today in the PowerPoint, for the most part, is written here in your benefit guide for you, so you can hold on to it later on in the year when you actually have to use the service and say, hey, wait a minute, how does that get covered again? You'll have it right here, along with phone numbers and contact information, all your important notes and all your benefits right here in front of you. Okay? You also have your per pay contributions. So this is, if I'm in your shoes, this is one of the first things I'm looking at is how much does it cost at my paycheck. I'm going to tell you up front, there have been some slight increases. We continue to see increases, significant increases in the industry overall. PSI continues to cover the lion's share, the vast majority of the premium costs. You pay a small portion of those premium costs every pay, and you'll see how those are. Still, there's slight increases to both plans, and I actually brought the 2014 or 2015 contributions. So if you're an individual on the 170 plan, that per pay contribution as an individual went up just over $2 a pay. And if you were on the 90/60 plan, it went from $14.93 to $17.47. So again, just about $2.50 increase from last year. So from an individual perspective, it goes on. I can go each one, but you can do the math and see your numbers. So you'll see very slight increases. I will tell you, I've been out there. We've been doing a lot of these meetings and a lot of increases we've seen, every year. I have a group implementing a $5,000 individual deductible plan this year for January 1st. So you know your plans are still very generous, and the amount that you pay is very low out of your pay. But that said, the goal of PSI is to continue to offer generous benefits, and it's our job to do that together to make sure that happens. So your payroll contributions are on your seat, and they're also in your benefit website. When you go onto your benefit portal to enroll, you'll see all those numbers as well. Dental and vision numbers have stayed the same from last year. Okay, let's get into your medical benefits. So from an industry perspective on medical, briefly, you continue to be with Cigna, so the same carrier, same network, great network, no changes there. Cigna Corporation is obviously a very well-known company, serves millions of people, very strong financially, and has a good focus on preventive and wellness, which I want to take a moment here, just because, again, I'm in insurance every day, and I probably get a little too excited about this stuff, but I think it's important for you to see how this works. If I'm in your shoes, I want to know from the guy who's in the insurance business every day, why are these costs continuing to go up? What's actually happening? You tell me every year the costs are going up, but what's happening? So there's a couple things I'm going to drill down here, not too deep, but just briefly before we get into the benefit changes for this year. So why do costs continue to escalate? And one of the things that we talk about, and I have talked about this every year, is we spend a lot of money in America to treat preventable disease. So there's been some studies out there that say up to 75 cents of every dollar is attributed to treating preventable disease. So we're spending hundreds of millions of dollars to treat preventable disease in America. So a big thing that we're talking about, and we continue to talk about, and PSI has embraced, and Cigna does a great job with, is trying to prevent preventable disease. And that's going to help our costs, not just at PSI, but across the country. So that's one big trend we see. So that's nothing new from last year. It's the same. It's been like that for a long time. Another one is technology. So in America, and you guys know this firsthand in a lot of ways, but in America we have this unbelievable technology in the healthcare arena that is saving lives all the time, and these new technologies that are coming out, very expensive. This one's a little older, but my father-in-law is a surgeon, and he was talking to me about the other day, I can barely pronounce it, laparoscopic surgery. You guys probably know more about this than I do, but the surgeons are on one side of the room with their hands in the game Nintendo system, and they're operating on a patient on a bed on the other side of the room. Fascinating. They can get very precise and very focused on their efforts, but what happens, those things cost a lot of money. Which leads me to my next point, is you've probably seen it in the news, pharmacy. So prescription drug costs. Anyone see the hepatitis C drug recently last year? Yeah. So we have a pill in America, well, in the world now, we have a pill to treat hepatitis C, completely treated. You need 84 pills, and it actually costs $1,000 a pill to take this drug. But we have a cure for hepatitis C. It's fascinating. It's one of the encouraging things about being in this industry is you're seeing these things come up, but it's expensive, $1,000 a pill. And we see it in our plans. We have, especially self-funded plans where we're seeing all the claims, we have groups that are treating this, almost $90,000 to treat somebody from hepatitis C, and there's more coming. So we had prescription drug seminars recently, and they're talking about all these new things, these blockbuster drugs coming over in the next couple of years. It's fascinating. It's unbelievable. It's great to treat some of these real significant issues, but they're expensive. So enough said there. But that's one of the reasons why costs continue to go up. And the last one, before I get into the details on how does this actually impact you and what do your plans look like, are ACA and compliance, Affordable Care Act taxes. There's a lot of taxes and penalties that have arisen over the last couple of years, and and moving into the next couple of years. So you probably are familiar with, I had talked last year about some of the taxes that were already levied on employer groups. It's already been on PSI, that PSI is already paying on your behalf. They're smaller numbers compared to the taxes that are coming. Cadillac tax, excise tax, it's how it's written in the law, but it's called Cadillac tax for probably most of us if we're watching the news and reading the papers. So the Cadillac tax says if a group offers a plan that goes over this certain level, the employer is going to be taxed 40% on that delta. So anything over that level that they've drawn in the sand, the employer is taxed 40% of that tax, and they're actually allowed to pass that tax down to employees. So some groups are saying, okay, well, I'm going to share this with the employees a little bit, I'm going to pass all this down to the employees, or I'm going to try to avoid it by making my plan a little bit, lower the or increase the deductibles a little bit, so I'm beneath that Cadillac tax. So I think that probably makes sense logically to everybody as far as the mechanics of it, but as far as why they're doing it, that's one other conversation I'll stay after and go into the political discussion. Okay, so your two medical plans with Cigna are still going to be this 170 plan and a 90/60 plan. It's a PPO open access 170 and a PPO open access 90/60. The big thing on the second plan, the open access 90/60 plan, there are no plan changes. So if you're in that plan currently today, there's no plan changes. You saw what the contributions are. By the way, don't check out on me here for a second when I say this, but if you don't do anything this year at annual enrollment, your current benefit elections are going to map into your future. So you don't have to go online and enroll unless you have an FSA. The IRS makes us have you go on and do that every year. But your current plans are going to roll over into next year. I still recommend you pay attention to the program and not leave on me and get your smoothie. But I just want to make sure you know that as far as what you have to do, and I'll say it again. So the PPO open access 170, there is going to be a small deductible on that plan this year. So we've added a deductible to that 170 plan. And that deductible is actually the same deductible as what we have on the open access 90/60. Okay? So you're going to say, well, what's the difference between the two plans? I'm going to talk about that today. You still have 100% coinsurance on your 170 plan, which means once you hit your deductible, and almost all line items on your benefits is covered 100%. Where on your 90/60 plan, once you hit your deductible, there is still some cost sharing up to a certain level. And those who are on the 90/60 plan already know that. So the 170 plan is still a very strong plan, very rich plan. Frankly, I still have some concerns, and we've talked about it, that we're going to be close to that Cadillac tax. So we've got to watch it carefully, but we've added that deductible this year to try to steer away as much as we can to save us all from increasing costs. Both plans have in and out of network benefits. That's another key point. So you're always going to pay more if you go out of network, but if you stay in network, you have in and out of network benefit. Okay, so there's a lot going on this slide. What I'd recommend is you just flip open to your benefit guide here, and we'll look at the plans next to each other. It's just a screenshot of your benefit guide. So if we go to page, let me just show you this real quick. Mission accomplished, by the way, today. If everybody walks out of here feeling comfortable on the content in this guide, at least you know where to go in the year when you're using your services. You know, okay, this is where I go to find out how this works. Page 3 talks about some medical definitions. So what is a PPO? What are copays? What are deductibles? What's coinsurance? Emergency room? Your login instructions, all that. But if you flip to page 4 and 5, you're going to see your two plans next to each other. Took some notes along this, trying to find out notes. You'll see your plans next to each other. Okay. So when we look at your PPO Open Access Plus 170, which, by the way, this has always been the plan that most folks are enrolled in. Over the last 3 years, we've seen a slow migration into the 90/60 plan. And what PSI has tried to do is offer two philosophies, basically a high plan, or not, I can't even say a low plan, because I got groups with a $5,000 deductible. So this is kind of a high plan and a not so high plan, or a high plan and a higher plan. I don't want to say that, but so two very, very nice plans. I don't want to say you can't go wrong either way, but they're both very good plans. And this 170 plan, what I thought I'd do is I'd take you through a couple of practical examples of how, if you had this service, how much it would cost. I think that's that's always helpful for me to think through it. So when you look at your 170 plan, you see you have an individual deductible of $250. So if you're enrolled as a family, each person in your family will have that $250 deductible up until you hit a $500 family max. So if you have 5 people in your family, but only so somebody on day 1 hits $250 deductible, and then you have your next family member on day 2, it's January 2nd, who hits their $250 deductible. You might have 10 kids, but all those 10 kids, you've already hit your deductible, so you're good. So now it's all set at that. That's where that $500 number is. Okay. So that's a deductible. Now you have an out-of-pocket max. You're going to say, how am I going to hit my out-of-pocket max? It's going to be hard for you to hit your out-of-pocket max if you stay in network. But that out-of-pocket max is set up so after you hit your deductible, if you have a bunch of copays. So say you were on prescription drugs of non-formulary, if you scroll all the way to the bottom, a $60 a month copay. That doesn't go to your deductible, but that will go towards your out-of-pocket max. So if you hit your deductible and then keep hitting copays on your prescription drugs, you could hit, be tough, but it'd be eventually you could hit your individual out-of-pocket max of $1,500. So both of these plans you'll see have the same individual.
It's breaking up, I can't hear.
The thing that we need to do is that in this situation, just dial for the phone.
Like from police.
Hey guys on the line, if you're talking, we can hear you.
Yeah.
That's Anvar.
I will tell you this, industry perspective, most plans have moved to a $6,350 out-of-pocket max for an individual. So your plans still have that security blanket, if you will, of a much lower out-of-pocket max, which is nice. ACA is moved to a lot of these plans to have that $6,000 individual and a $13,000 family out-of-pocket max. Okay, so what's the difference in these two plans? Here's the next line, coinsurance. So if we look at the coinsurance level, we got a coinsurance in the Open Access Plus 170 plan, you have 100% coinsurance on that plan versus your Open Access 9060 of 90%. Well, what is coinsurance? Coinsurance is a percentage the insurance carrier Cigna will pay of the procedure after you hit your deductible. Okay, so I'm going to use an example here in a minute. I'm going to scroll down to your hospitalization. So if you were to have an inpatient hospital stay, which by the way, you guys remember from last year, the average cost of an overnight in the hospital? A lot of people think it's their $250. Well, it's not. What's that? Yeah, good memory. Yeah. So do you hear that? $10,000 is the average overnight. So if you stay in the hospital, it's the average cost for an overnight in the hospital. Nationwide, as we look at the averages, we've looked at from a trends perspective and benchmarking, the average inpatient, which is more than one night, it's, I think the average is like 2 or 3 nights, you're up to almost $25,000 for the average inpatient stay. But I'm going to do for easy math and one night in the hospital, we're going to say $10,000, and again, you'll see why I do this in a minute, you probably already have, but a $10,250 inpatient hospital stay. So let's use that as an example, okay? So you have a $10,250 hospital stay on January 1st. Look at your plan grid, and if you're on the 170, how does that work? If you go in network to a hospital that costs the stay is $10,250. You'll pay your $250 deductible, and then go down to the hospitalization inpatient. It says what? Okay, so for that inpatient hospital stay of $10,250, you can spend how much? $250. Okay.
But then don't you have to pay $200 co-payment?
Nope. No, this is 100%. This year it's 100% after the deductible. You pay the $250 deductible, and then you pay then the plan pays on this first plan 100% of the balance, which is, that $10,000. They pay the $10,000. But now,
So this is that 200 co-pay per visit after plan deductible.
oh, you're looking at the emergency room. Yeah, we'll talk about emergency in a minute. That's actually a great point. We're talking emergency room up here too. But let's start with hospitalization. So if you scroll down to the hospitalization section right above emergency room, that's the section that we're looking at. Yeah, so emergency room is a different item. We'll talk about that in a moment, okay? But no, that's a great point. Okay. So now look at that same $10,250 hospital stay under the 9060 plan. You guys have probably already jumped ahead, but how much would that one cost? You pay your $250 deductible. Yeah, $1,250 I'm hearing. Yeah, that's correct. So again, you got $1,250 deductible. Now let's say on January 3rd, you have another overnight in the hospital. How much does that one cost? Another $250. Why? Right, because you've hit your out-of-pocket max of $1,500.
So you don't pay anything?
Yep, if you stay in network. Stay in network. Okay.
Does it have to be you or anybody in the family?
So for each person, it's that individual. Each person in your family is, and I'm just using this example as that individual column, but each person in your family would have that individual up until that family max of the 500, 3,000, which is like 2 people. These are good questions. I just want to make sure you see how this grid works and really how, compared to the actual cost of these events, how much it costs for you guys. Okay. Okay, so we jumped ahead to emergency room, which is great. Let's go there. I used this example last year. I have 3 young kids, so I could tell you 15 different examples in the last year. I can't remember what one I used last year. I think it was my oldest daughter on her bike, and that's an easy one, so I'm just going to, I think, do that one again. But so it's Saturday. My oldest, a 6-year-old, is on her bike. She's riding around. She falls off her bike. She skins her knee. She's bleeding all over the place. Mama's crying more than she is. We get in the car and we run to the... Everyone says emergency room, right? I heard some people say urgent care, though. Well done. Right, well done. It's always for a non-emergency. If you look at your plan grid, and some of you guys have jumped ahead and done it, if you look at your emergency care grid, you also have urgent care. You're always going to pay less and wait less to go to the urgent care. So practical tip from the insurance guy once a year, know where your local urgent care is. Okay. Some of them, some 10. So look at the ones close to your house and know where they. Now, if it's a true emergency, go to the emergency room and don't say your insurance guy told you to go to the urgent care. But you're going to want to go to the urgent care for the non-emergencies because you're going to pay less on your plan. PSI is going to pay less, by the way, because on the back side, Cigna is going to pay $10,000 for or a couple $1,000s. And by the way, just real quick, I think I told you this last year. I personally am on a $2,500 individual plan deductible. So every time I go to the emergency room, it costs me $1,000 until I hit my deductible. If I go to the urgent care, it only costs me $70. You guys, you can see how it plays out, and I wait less. So know where your local urgent care is, especially if you have young kids. Okay. Let's keep scrolling down here. We'll move along. Maternity care, you see how that works? Very similar to the hospital and specialist co-pays, in which, by the way, let me highlight that. You pay $30 for a PCP, primary care visit, $30 for a specialist. The average cost for a primary care doc is about $140. Average cost for a specialist is closer to $300. So you guys are just paying the co-pays there. Great, on both plans. Now, if it's a wellness visit, if it's a annual physical, child immunizations, age-appropriate tests and screenings, how much do you pay for those? Correct. You guys are good. So that's ACA, Affordable Care Act, that they mandated that anything wellness preventive coded is 100%. Now, if you go for one of those age-appropriate tests and screenings and they find something and they decide to do something about it, it's going to cost you not as a wellness visit. It's going to cost you as a sick visit. So I just make sure you're aware of how they code it is important. You go in for your annual physical and you start complaining about the flu, you're going to pay a $30 copay, probably, unless the doctor likes you or prescription drugs is the last one. $15 copay for generic drugs on both plans. Sometimes you can go to Walmart and find them for less expensive. Go ahead and do it. But if you get it through your plan, it's a $15 copay. For your formulary brand, okay, so there's brand name drugs that we get a better contract with. Cigna has a better deal with the pharmacy manufacturers. You're going to pay anything on that list, you're going to pay a $35 copay. And all that information's on the benefits website and on the Cigna website. And then you got your non-formulary brand name drugs at $60. Those are your brand name drugs that are not the good deals with. You're going to pay $60 for those. The average cost for a brand name drug in America, before we start talking about these hepatitis C drugs and specialty drugs, just the normal brand name drugs, the average cost is $300. So you guys pay a $60 copay for an average cost of $300. We've also seen, I didn't mention this before, but generic drug prices are also going up because the pharmacy manufacturers are buying each other and there's less of them. And so your actual generic costs are going up as well. For those of you who are economics fans. Okay. Any questions on the two plans this year? Yes?
So I understand the hospitalization scenario, but what if you, like, just a more practical one,
Yeah.
you're going to your doctor January 4th.
Yep.
It's not a preventive care, it's just like a follow-up
Yep.
visit or something. So you said it's roughly $140 typically for an office visit.
Mm-hmm.
So since that's within my deductible, I would actually pay that entire amount, and then...
No, and actually, and so sorry if I'm making this more complicated than your plans for your PCP visits and your specialist visits, you're just paying a copay.
Okay.
Deductible.
It says here, it says 100% after the plan deductible.
Yeah, those are for your X-rays and lab tests. So if you scroll that line over, yeah, but let's slow down there and let's talk about that. So.
See physician services, office visit.
Yeah, so if your office visits, you're just going to pay that $30 copay for your PCP, primary care physician, or $30 for a specialist. No, that's a great question. Let's slow down on that. The x-rays and the lab tests, you are going to pay the deductible, so whatever those costs are up until you hit your deductible, and then it's covered at 100%. And that's a good time to slow down on that too, because a lot of times your doctor, you go to your primary care doc, they might recommend you go to a lab that's out of network. So just recommend you do your due diligence. I see that a lot. Employees talk to me a lot and say, hey, my doc sent me to an out-of-network lab and I had to pay a lot more. Just make sure your doc sent you to an in-network lab, and you can check, again, all your contact information in your benefit guide to go on the Cigna website and find an in-network provider. Just do your due diligence. It'll save you a couple bucks and some hassle later on. Make sure you're going to an in-network lab. And actually, it just made me think of a point. This is one important thing. We mentioned emergency room before. A lot of these things, when you have an emergency, they don't expect you in the back of the ambulance to be trying to make sure they're in network and ask them how much it costs. So when it's a true emergency, and if it's truly an emergency, it'll be you're okay there. Now, where we get into some trouble sometimes is if it's a non-emergency. If someone's using an ambulance just because they didn't feel like going to their primary care doc, you're going to pay for that as an out-of-network. But if it's a true emergency, don't worry about calling Cigna to make sure the ambulance driver's in network. Okay. So I just want to make you made me think of that. We've seen yeah. Okay, yeah. Yes, sir.
So if I go to my physician and he refers me to somebody,
Uh-huh.
and I say, is he in or out of network? Can I expect my physician's office to know if that person's in or out of network?
That's a great question. And guys, a lot of times, short answer, no. Don't trust a doctor. Now I say most of the times they're going to be right. That said, in your benefit guide, there's a contact page, Cigna benefit website. You're going to be able to find who your in-network providers are. In most cases, they're going to be okay. They're going to be in the Cigna network, and the doctor, if they say, yeah, they're in Cigna, yeah, we've done this before, they're good. But if I'm in your shoes, I would just go to the Cigna website and make sure that their lab they're sending me to or the specialist they're sending me to is in fact in network, because the doctors don't always know. They work with these guys a lot, and they might be in the Blue network, or they might be in some other network, but they're not in the Cigna network, or vice versa. So they probably will know, but I would recommend you confirm it. Call the number on the back of your ID card, confirm it. Go online, confirm it. Yes, sir.
Is there another level for the prescription? Is there like specialty formulary?
No. So as of now, and Adrian, correct me if I'm wrong, but as of now, the way the current plan design is set up, no, these are your 3 copays. Yep. Now we do have some plans that are, we see a lot of groups who are starting to look at that differently and say, hey, let's put another copay or cost sharing, co-insurance on the specialty. But as of now, no. But there are plans out there that do. But right now, you'd be in the non-preferred brand. Interesting.
So you want to look, so if you have any questions at all about your plan, or if you're paying too much, on the back of your cards, there's that 1-800 number. They'll be able to actually go in and look at your plan and your claims and tell you exactly why.
If you say there isn't anything above 60, then why not use that?
And that's what I'm saying. I personally can't answer because I don't know your claim.
Okay.
What's a really good thing to have is this. So when you go for your preventative care, this is in your packet. It's your preventative health care guidelines. This breaks down with your age, your gender, different tests that are covered. So with your preventative visit, we mentioned that it was covered at 100%. We can no longer go to the doctor with that list of 6 things that's been happening to us in the last 6 months, because that's not your preventative visit. That will be a sick visit. So please make sure you look at this based on your age and gender and say, okay, this is what I'm able to have under my preventative care. And women, you're able to have a well women visit and a physical, so you can have both of them in the same year.
This list of preferred medications in here, is there, it's 2015, or is there going to be a change to that in 2016?
So that's a living and breathing document. So the best,
online?
yes, the best way is to check online because it continuously changes.
Do you guys hear that question? That's an important one. The preferred brand name listing in the packet. Those are, I would check online for the most recent. They're out of date as soon as they print them because they're always updates. Yep. Great point. And actually, I was just thinking about that when you said it in a higher cost. Yeah. So another, the only under the plan design, if it was going to cost you more than this, you can actually set it up. So let me go here. Do I have it in front of me? Actually, it's in your benefit. I believe it's in your benefit guide. It's not. So you're actually going to pay. You have an opportunity through the PSI plan to set up mail order. So a lot of the maintenance drugs that you're taking every month for the foreseeable future, you can set those up as mail order, and you can call through Cigna to do that. Now, why would you do that? The reason why you do that is because you're actually going to pay 2 copays for the mail order. So depending on what section you're in, you might pay 30, might pay 70, or might pay 120. So maybe that was a number. You're going to pay 2 copays, but you're going to get 3 months supply. So you're going to save yourself a copay to do the mail order. Thank you for that. Good reminder.
Does that apply on generic and formulary brand?
You'll have to call Cigna to work it out, but it's usually for maintenance drugs.
No controlled substance.
No controlled substances, right? Yeah. Okay, guys, I'm going to stick around after, and I want to make sure we get to the other benefits. These are the biggest changes, but I want to make sure we're able to slow down a little bit on the life insurance as well and explain how that works. So we'll stick around at the end of the presentation for any specific questions. Thanks for the dialogue, by the way. Okay, so the comparison, you've got that. We've talked about most of these. We talked about staying in network in the labs. We talked about generic drugs. Sir, thank you for bringing up the mail order. That was a good call. You'll save money to set up the mail order. I would recommend that if you're on a maintenance drug, non-controlled substance. You've got your urgent care we talked about. Plan ahead pre-tax. So most folks are aware of the fact that you've got an FSA, all right? So what's an FSA? That flexible spending account. You can set aside money on a pre-tax basis to pay for qualified medical expenses. So your deductible, your co-pays, qualified dental and vision expenses. You can put money in your FSA to pay for those expenses. Now, if you don't use the money at the end of the year, you lose it. So that FSA, you want to make sure you're conservative about how much you put in there. And wellness, we talked about in the beginning. Actually, that's a great point. We have a slide in the FSA here in a minute, but while we're talking about it, let's talk about it. On that FSA, you are allowed to roll over 500. IRS has allowed that and some groups have agreed to do it. PSI has done that because it's better for you. You know you're not going to lose that first 500. Your deductible is $250, even on the high plan. You might think about putting at least $250 in because you know you're not going to lose it. So something to think about. And all that's done on the Kelly website. You'll enroll on all your lines of coverage, and if you want to do on the Kelly website your FSA, you can do that as well. Please note, and I want to make sure I say this one more time, the FSA amounts will not roll over. So if you're in an FSA today, it won't automatically roll over. The IRS won't allow us to do it. We would love to because it's easier for you guys, but they won't let us do it. So just make sure if you want to continue your FSA election, your flexible spending account election, you go in and enroll in that. Okay.
So if you don't enroll, it won't roll over?
Correct. Yep, so make sure you're going. Now, I'll tell you, they've continued to streamline the benefits enrollment system, and some of you may have already been on it this morning, but it'll show you a green checkbox on where you already are, and if you don't want to change, you don't have to do anything to those lines. You can just go right to the FSA, zoom in on it, put your number, move on, done. It's very simple. The hardest part about the benefits website is signing in, because it's secure sign-in, bank strong password, and once you're in, it's very simple.
There's a green check mark and you click on that. I spent an hour trying to sign up for it this month.
Did you? Well, you know what? I'm here. I'll take a look at it with you. But no, the green check marks are those that you're already in. If you don't do anything, it'll just flow through. You got to go down to the ones where they don't have the green check mark, and those will show you where you got to go and make sure you've got an enrollment. And sorry, this taking a little while. Okay, so guys, your wellness corner. We've got Cigna sponsored and PSI sponsored programs. No changes here as far as I'm concerned, as far as I know of April. I don't know if you want to, but this again, as far as PSI's commitment to trying to set up a culture where where wellness and prevention is encouraged, it's great working with you guys because you already have a lot of this stuff in place. And this is all in your benefit guide as well. Other benefits. So dental. No changes to your dental, and so for the sake of time, I'm going to keep moving, and we'll stick around if there's questions at the end, but you're still with Cigna, same plan design, same costs out of your pay. So no changes there. For new hires, I'm here around if you want to ask questions. Same thing with vision. No changes to the plan design, no changes to your costs out of pocket through Cigna. We've talked about that last year, and it's in your benefit guide. Group ancillaries, I'm going to slow down here just for a minute and just highlight the fact that these are employer-paid benefits, life and disability. So you have a life paid benefit, which you'll see is 2 times your salary, up to $200,000. So I'm just asking you to slow down and think about it once here. I'm not a big life insurance guy. I don't like to talk about this for too much, and my wife hates it even more. But if something were to happen to you, do you have enough money to cover what, if you were no longer here for those people who aren't, your loved ones? Everybody's in a different situation. I have 3 kids. My situation changed as I started having kids. Your situation changes as you have certain financial obligations. Again, I'm not trying to sell this. I don't personally make any more money if you buy this or don't buy it. We just want to make sure that this is out there and you think about it. A lot of people don't think about life insurance, and this is a good time once a year to think about it. You do have 2 times your salary. PSI provides for you. They pay for this for you, okay? make sure you name your beneficiary on your website, because everybody has a life insurance program. I just had a call 2 weeks ago from an HR person who said, hey, I just had one of my employees die and they don't have a right beneficiary there. What do we do? Sorry, it's in there. That's all we have. So make sure your beneficiaries are updated. That's important. Short-term disability, long-term disability. These are the coverages that cover your income if you were to get hurt outside of work. So workers' comp requirement, you have that if you get hurt on the job, but PSI cares enough and has a generous benefit program where if you get hurt outside of off the job, you've got coverage to cover your income. 60% of your weekly salary up to $750, and then the long-term disability, 60% of your salary up to $5,000 a month up to Social Security normal retirement age. Very generous benefit. All right, now I got to slow down on this site because remember, or on this sheet. Remember, if we don't hit participation this year, anybody in a voluntary life plan, the voluntary life plan with PSI will go away. So we've talked about different ways to communicate this. We just thought the best way to do it is just be honest with you and tell you the situation that we're in. So if we don't hit the numbers this year, if we don't get enough people to enroll, they're going to take the system away. And I do have the number written down. I'll tell you at the end. I gotta go back and look at it. I believe it's 40 people. We need 40 people to sign up within the domestic and international population. If we don't, it'll go away. Now, if you're one of those people on the plan and say, hey, wait a minute, I got voluntary life insurance here. What happens to my life insurance? We can work with Mutual of Omaha to try to get it so you can port that coverage to an individual plan. The cost will likely change, but you won't have to do the medical paperwork again. So if that in the event that we do have to cancel the plan, we'll make sure we coordinate to make sure you can try to port those policies to individual policies. All right. But the goal is that we don't have to do that, and we get a couple people to sign up, 40 people to sign up, and we hit it. Now, the costs are not that expensive, and I'll show you this in the handout. We had it somewhere. Give me a second. So this is an age-banded. It's an age-banded rate. So the minimum that you can get is $10,000. So if 40 people get $10,000 of the benefit, it'll cost, depending on your age, you can see it's the rate table here is the rate per 1,000 for the voluntary life. And you're gonna say, I don't want to do all these calculations. This is all online. So when you go in to enroll, you can pick the amount that you want, and it'll show you the cost because it knows your age. Our system will do that calculation for you, but you can do the quick math if you like here. But so for $10,000, you can see it's not that expensive, and this is a rate per unit. So it'll calculate it to show per pay, and we've done some examples. A 32-year-old spouse for $10,000 of life insurance will pay $81 a month or $41 a pay. That's 41 cents a pay. I'm sorry, it's 81 cents a month or 41 cents a pay. So you can see how that calcs out. Okay, put the decimal in if you got a pen in front of you. Any questions on the voluntary life insurance? Mutual of Omaha has said no medical paperwork up until the guaranteed issue. We're going to give you one more chance, Kelly, PSI, one more chance to hit it. If you get up to the guaranteed issue of $100,000, they won't make you fill medical paperwork out. Same for your spouse, up to 10. Child up to 10. So think about it. No pressure, but think about it. Next question.
You decide to take it if you reach this 10K ceiling, then you have to actually register with an individual voluntary life insurance, or we can just.
Great question. So let me make sure I understood the question right. So say you're an individual and you say you want to go over the 100,000 amount? No?
If I choose to join the program,
Uh-huh.
but the total number of PSIs only
Yeah.
choose
Uh-huh.
reach the ceiling that this company Mutual of Omaha have.
Right.
Should I become an individual?
Yeah, then if that one, yeah, that's a great question. So in that event, so if we have people add or people who are already currently on or people try to add and then we miss it, by the way, nothing's going to get taken out of your pay until we know if we've hit or not. So you're not going to have any of that backstory. But people who try to get it and can't, we're going to work with Mutual of Omaha to reach out and to get set individual policies set up. And as far as filling out the medical paperwork for those new people, I'd have to confirm with them, but the goal is we're going to hit our 40 and we're going to do it, and we're not going to have to drop it. But you'll be able to set up an individual policy. How the mechanics of that, yeah.
I just want to join it if PSI has the warranty, with this price. I don't want to pay more.
Right.
Just choose not to join it.
Yeah, so at that point, if it falls away and it turns off and we say, hey, we don't hit our 40 people, then you can choose at that point, I'm done, I'm out. I don't need to pay anymore. You can do that too. Great question. Thanks for clarifying. Yep. Okay. Any other questions on life insurance? All right. Employee Assistance Program through Cigna. So this is good just to highlight. This program continues through Cigna. So you have access for free confidential for employees and families, helps you find various answers for personal concerns. 1 to 3 face-to-face sessions with a counselor in your area. That's unique. A lot of the EAPs that we see, it's just telephonic, so that's nice. Just remember you have that out there. Your FSA we talked about. You got that pre-tax deduction. You got the use it or lose it rule, but the $500 that we talked about, you can hold on to that. So again, just practical tip, you got a deductible either way in your plans this year. You might want to put in at least that deductible. It's going to roll over. The dependent care FSA is for your dependents. Nothing to do with medical expenses. It's for daycare, certain elder care, and it's pre-tax deductions up to a max of $5,000 per plan year. Sorry, let me back up on the FSA since we do have a couple more minutes. On the FSA, whatever you elect for the FSA, you can actually use that on day one. So say you put the $250 in to your FSA, and it's going to get that $250 is going to come out of your pay every paycheck, okay, into the FSA. On January 1st, if you have an event where you got to hit your deductible, you'll have all that $250 up front ready to go on day one. So that's how the FSA works. Yes, sir. Did we move it to $2,550 this year? I thought we kept it at 25. Was it 25? I'm sorry. 2,500. Yeah. So the IRS allows 2,550, and we did 2,500 because of the administration. But you did pick the $500 rollover. Yeah, it is 2,550. Benefit guide says 2,550. We'll circle back on it, but yeah, last year, right at open enrollment, when we were getting up here to do these meetings, the IRS came out with a publication that it went from 2,500 to 2,550. So it was too late to make the change, and I didn't think we did it, but maybe WageWorks did go through with it. So you potentially have 2,550. We'll confirm that. We'll send an FAQ follow-up. But yeah, thank you for that. And your benefit guide does say 2,550, so I'm going with the 2,550. Yes.
When you say that as long as you enroll that your FSA will roll over, I mean, can that be over multiple years?
Yeah, but it won't accumulate above 500. So the most it'll roll over from one year to the next is 500. Right. Yeah.
But
so
if I have 250 in it, and then I only use $50 of that, and then I can roll the $200 the next year.
Yeah.
And if I use $50 of that, I can roll the $150
Correct.
the next year. So you can just keep.
Yep. That's right. That's right. Yep. That's a good question. So that's why the recommendation would be on the on the 250. Now, obviously, if you leave PSI, this money doesn't go with you. But that would be the deal there. Yes.
For FSA, you said if you leave the company, the money can't.
Yeah, the FSA money doesn't follow you. Correct. Yeah, it's that's not the way the account's set up.
So if you have a fully funded your plan and you use more than the 2,550, PSI keeps that cost. If you have used less, then PSI keeps them.
That's correct. So just to elaborate there, and I think just a reminder to everybody, this FSA, PSI does take some exposure because if you elect $250 for January 1st and you haven't taken it all out of your pay because it's broken up over the 26 pays, it'll go into your, and you use it on January 1st at $250, and then you leave on January 3rd, PSI's out that money, Now, then that, and the other side of that thing is if you leave, you're not taking the money with you. Thanks for that. Any questions on the FSAs? Gotta close it up here. Additional benefits, details in your benefit guide. I think most folks are aware of this. Vacation leave, sick leave, 10 holidays, pension retirement plan, retirement savings plan, commuter expense. I'm not an expert on most of these. I know these are internal. I don't know if anyone wants to have questions after, maybe for April or HR. I'm not going to cover these now because we're running short on time, but great additional benefits. You have a new benefit, any perk. Did you want to speak to that at all? Or I know we're getting close to the... Yep, we can stand close here. Team effort. Yeah.
So you all will be getting an email about this tomorrow, and it's very self-explanatory, but we just want to introduce an additional savings plan to you all right before the holidays. So if you want to shop or travel, there are significant discounts, 20 to 30% on average. You'll get an email if you have questions. Feel free to stop by the 4th floor and we can clarify in greater detail.
Yeah. I got to incorporate some of this language into the healthcare slides. Why it's awesome. It's good. All right. All right, we'll land the plane here with enrollment tips and reminders. So everything that we've talked about today is effective January 1st, 2016. So all your current benefits, everything that you have currently in place, stays in place until January 1st, 2016. Try to give everyone time to think through this and make their decisions. The open enrollment site goes live today, and it's going to close. It's due by the day before Thanksgiving. So you're going to have time between now and Thanksgiving to go online and make all these decisions. If you don't do anything, again, it'll roll over except for your FSA. Your benefits website, you have the mybenefits.psi.org, login instructions in your benefit guide, and the blue and the highlighted. Remember, it's a true open enrollment for your voluntary life. Unless a qualified life event. I'm jumping all around on this slide, but the qualified life event is if you have a birth of a child, your spouse loses coverage, anything that happens mid-year like that where you have to get on the plan or off the plan, you get married. You can make changes mid-year for qualified life events, but you can't just get on and off the plan willy-nilly, as you know, because it's a pre-tax benefit. And lastly, the PSI benefit website. You guys have seen this, and actually you're going to get this even better this year. It'll show the check boxes here if you're already done. I wanted to show you this slide. So it's the last slide. It's just a good reminder. Your healthcare W-2. So you've probably heard about it in the news. The ACA healthcare reporting. You're going to get a form called 1095 this year. So when you file your taxes, if you have a good accountant or if you're on TurboTax, they're going to ask you for this 1095 form and ask you to populate information from the 1095 form when you file your taxes. You're going to get this form through PSI. Kelly and PSI have a joint solution through MZQ Consulting. I'm not sure the logo that's going to come on it, but you're going to get a healthcare W-2, this 1050 form, this January when you get your other W-2s, and you're going to use it to file your taxes. What this does is it provides proof that you guys have qualified healthcare coverage. So some of our plans back historically prior to ACA had these super high deductibles, or they said they're caps. We're only going to allow $50,000 worth of costs, and then after that, the employee has to pay for it. You guys have a very generous plan. You've met all the requirements, and in fact, you're almost too high. So you have a very generous plan, and so that this is going to say that. So when you file your taxes, is proof that you're actually enrolled in a plan that's right per the ACA, compliant. You're only going to get one form, so you might have to make copies for other folks who need to on your coverage that file taxes. Any questions on the healthcare W-2? This is new this year. Okay. Oh, right, pop quiz. So we'll go with the flashlight first. I got to think of I should have prepped some better pop quiz questions. What is the individual deductible on your 170 plan? Yes. 250. Would you like the mini mag light or the bag?
I don't know, whatever you want.
You got to pick one.
Bag.
Okay, yeah, I like the bag. It's a good summer beach bag. Okay, then let's we got 2 minutes. Let's make sure you see. You got this includes batteries. and the Kelly logo, so you can remember us. Okay, I'm stalling. What is the guaranteed issue for voluntary life insurance if you're an employee, where you don't have to fill out medical coverage for? How high can you get? Yes, sir. $100,000. We had a hand raised back here. Sorry. All right, 100,000. Yeah, good job. All right, all. Thanks so much for your time. I appreciate it as always. We'll stick around if you have any specific questions. Call it. And don't forget the smoothie bar. I heard him making smoothies.